India has strongly objected to the use of mathematical models by the World Health Organization for projecting excess mortality estimates linked to the coronavirus pandemic. So, why don't the WHO numbers seem believable?
So, what has the World Health Organization said? The WHO numbers say that in India, uh, 4.7 million people, that is 47.4 lakh people, have probably died because of COVID, because of infection as well as indirect impacts of COVID. So, somebody say unable to access hospital services or medical care uh, because of the lockdown, those category of deaths probably would also be included. So 47.4 lakh COVID-19 deaths in the country. Uh, in the 2 years, first 2 years of the pandemic, that is 2020 and 2021. That's what the World Health Organization says. Now, that's almost 10 times the official figure that has been put out by India. So between 2020 and 2021, India reported roughly 4.8 lakh cases. Also, the official toll is it's not just WHO which is saying it, but widely I haven't spoken to one single person, even from the government, which says that the official toll is 100% correct. Almost everyone agrees that there is an undercount, and this kind of undercount is not specific to India. Almost every country's official death toll uh, would probably be an undercount. It is the scale of the undercount which is a matter of debate, and that is where people differ.
We had COVID deaths occurring, and we did not have a definition of death. Not even the WHO had any definition for death after COVID-19. When till I've become positive today, I die after 2 weeks, will it be COVID death? I die after 2 months, will it be COVID death? I die after 6 months, will it be COVID death? So that definition, we looked at all the data that we had, and we came to the conclusion that 95% of the deaths that occurred after testing positive for COVID-19 were occurring in the first 4 weeks. So a cutoff of 30 days was given for the definition of death.
India has been clearly telling WHO with all humility and through diplomatic channels, with data, with rational reasoning, that we do not agree with the methodology that has been followed for us. They have used a methodology for several nations which is based on systematic collection of data on deaths. We have a similar system. We have a robust system of the CRS, and we released that report yesterday. And we have actual count of deaths for 2020, and as per law and the timeline, the 2021 numbers will also come up. So civil registration system of India provides accurate estimates emanating from the ground, certified and validated by the district and the state administration.
The official toll is not a permanent or at least not a static number. It's being revised continuously. And if you see in the case of Kerala, for example, it's updating its death toll with backdated deaths on a daily basis. Other states do it periodically. There was a time last year when Maharashtra was also doing it on a daily basis. It was adding lots of deaths which had not been counted previously, but subsequently it became clear that they were indeed caused by COVID-19, and they were like being updated constantly. There are other states which do it at a periodic level, and recently, I think just last week, we saw Assam, for example, adding 1,300 COVID-19 deaths at one go. Looking at data and verifying them as COVID-19 deaths. So this is being constantly revised. It's not a figure that that has already been arrived at. It's a figure that is under constant revision. Also, the fact that once the data collection and also the part of the process of verification on whether it is COVID-19 death, that takes time, and we have seen several states looking at their uh, past data and revising their overall official death toll. So that's one part. So the data, the death toll that we see right now is not the final death toll. It is not the accurate death toll as on date, but it is up for revision, and we will see it, this revision happening constantly. Studies and also the WHO data, these are results of modeling exercises. Now, they take the primary data from the government records, and also fill it up with other sources of data, and they put it in computer models which are based on certain assumptions about how deaths have been happening, how the pandemic has been behaving, and based on those assumptions, these models make work some equations, and they throw up a few numbers, and it's usually in the large range. So the models are trying to throw numbers as the actual, what they think would be the actual numbers as of now, right? So there is a wide disparity because of the methodologies that are being adopted in calculating these numbers. The official death count is a direct count of the deaths. The numbers that we see from WHO and other studies are calculated indirectly through some modeling exercises. Of course, they are based on the primary data, of course, is coming from the states, but then they are put in some amount of some kinds of modeling, some computer models, and then based on certain assumptions, they are arriving at this data. So that's the reason why you see such wide variety, such wide disparity in the numbers. Any computer model. This is not just about this pandemic, but in general, any modeling exercise is only as good as the assumptions that it is based on. There are certain assumptions that go in while writing the algorithms for these computer models, and those assumptions are based on certain past data, for example, or some ground realities which the researcher thinks is the right way to look at those things. So any model would only be as good as the kind of assumptions that are made, the quality of assumptions, and also it depends on the quality of data that is being put in. If the input data is not very good, then obviously the output would not be very good. But these models that are being used, there is no doubt about the fact that probably these models are academically very robust models. They have been in use for several years, and they are used by scholars across the world. So there is no reason to doubt the credibility of these computer models. Of course, they have been peer reviewed. The entire methodology is out in the open, and it's a normal sort of academic exercise that researchers indulge in, using these computer models to sort of estimate these kind of, in this particular case, estimate the deaths of that might have been caused by the pandemic. When you say India's models, India, when we look at the official death toll, it is not based on any model. It is a direct count of the number of dead. Uh, Also, when you refer to the CRS, for example, which is the civil registration system, the data for 2020 just came out, 2 3 days ago. Now, again, CRS is a direct counting method. You are literally counting your dead, and the way it is done is because there is a law mandating the registration of all the births and deaths. So every birth and death has to be registered with the government officer. at the district level, then it's compiled at the state level, and then it goes at the central level. So it's a direct counting of deaths. It's not a modeling exercise, right? So what we see is uh, the registration of deaths in India has been, it follows a fairly robust process, and it has been going on for quite some time, for 50, 60 years, and the data is fairly robust. And specifically in the last few years, we have seen the registration of deaths has increased very sharply in the last 2 or 3 years. What that means is that now more than 90% of all deaths in India get registered. What, in other words, we are able to physically count 90%, more than 90% of all the deaths that happen in India. So we have a fairly good, fairly good system of counting our dead. The modeling exercises, as I said, gives an estimate in the interim period. The actual counting of the dead through the civil registration system, or a parallel exercise which is called the sample registration system, they take time. The physical counting of the dead would take some time, and that is what is happening. That till those data, which would probably conclusively prove how many people died in the country, and that would be evident when the SRS data comes about, that is the sample registration system data. When that comes about, no, that would put an end to these question marks on what actually is the actual death toll in the country. The problem is that even for 2020, the sample registration system data is not yet available, right? In the normal course, it would probably have been available by now, but as we know, 2020, everything got disrupted, including this exercise of data collection through the SRS, which is delaying the compilation of data. And in the interim, we have these results of such modeling exercises, which which are showing numbers, the kind of numbers that WHO is throwing up. Once the SRS numbers come, and we have been given to believe that probably the SRS data for 2020 would be available by the end of this year. Now, that would put an end to all sorts of a speculation on actually how many people died of COVID, because that particular process is a fairly robust process, and there are very little question marks over the numbers that are thrown up by that process. So we will have to wait for this SRS to conclusively to understand how many people died. What we know from previous SRS exercises is that in any given year, on an average, about 83 lakh people die in the country every year. So on an average, 83 lakh deaths happen every year. Now, of course, there would be year-on-year variation. Some year you would see 82 lakh, some year you would see 85 lakh. But on an average, for the last 15 years or so, 83 lakh people die in the country every year. Now, what we hope to see, if WHO says that COVID-19 itself, caused 8.3 lakh deaths in the country in 2020, then the SRS data for 2020, whenever it comes out, should show that the total number of deaths in the year 2020 was not somewhere around 83 lakh, but probably was in the range of 88, 89, 90, or maybe even more than 90 lakh, right? So if the SRS says that whenever the report comes out, there is no question mark, then you have to, you have to accept the numbers that are thrown by SRS, and all these studies and all these WHO numbers would be proven right, of course. If the numbers are not in that range, then probably those many deaths have not been caused. So what the SRS gives you now, because it does not give you the cause of the death, we can only assume that uh, you know the excess death, supposing, for example, SRS gives you SRS data says that 90 lakh people died of total number of deaths in India in 2020 was not 83 lakh, which is the normal, but 90 lakh, supposing. So we can say that there were 7 lakh additional deaths. Now, when we get that data, that 7 lakh, still we cannot say that those 7 lakh deaths happened because of COVID. We can still not say that, because the cause of death is not provided. But what we can surely say is that uh, even if we think that all the additional deaths in that year were caused by COVID-19, then we get an upper limit, an upper bound on the COVID-19 deaths, and that would be 7 lakh, right? So that's the upper bound. Now, of course, it's not even that simple. There are additional complications wherein, demographers will also take into account the fact that, certain kind of deaths that probably happen in a normal year, say road accidental deaths or industrial accident deaths, would probably have gone down in the year 2020, because there was a prolonged period of lockdown, so not enough traffic on the roads, and probably the road accidents would have gone down. So you have to make adjustments for those kind of things when you are trying to look at the COVID-19 data. But even if we even if we keep aside those kind of additional technical difficulties in trying to assess the COVID-19 death toll, we would have a fairly good estimate of the upper bound once the SRS data comes in. So the SRS data probably would be available for 2020. It should be available by the end of this year. So that's what we have been told. So we will have to wait for SRS. In the meanwhile, when these kind of data comes in for academic exercise, it's a perfectly fine kind of exercise that researchers indulge in, trying to estimate the number of dead. But we have to be a little bit skeptical about these dead. These are probably, as I said, these are result of modeling exercises, may or may not be entirely correct, and till they are till we have conclusive evidence, I think we just need to hold our horses. As an academic exercise, it might be good to look at what might be the actual number of deaths, but that's as far as we can go. This is not uh, a conclusive evidence of the number of dead in India. It is one more piece of you know uh, data that just adds to the volume of other studies that probably have thrown up the similar kind of numbers.